Hepatitis is a disease which is, if we talk about the number of cases, very quickly it is spreading in various parts of the globe. Be it hepatitis B, be it hepatitis C, or various other kinds of hepatitis. There are so many people who are becoming hepatitis positive with each and every passing day. Now when we talk about hepatitis, the worst part of this disease is that when a patient becomes hepatitis positive, the patient is tagged that you are suffering from hepatitis. So, all of a sudden, the whole thought pattern life of the patient changes. The patient approaches various kinds of physician. If the patient is approaching in Ayurveda, those physicians which are not that knowledgeable, they start liver tonics in those patients. Some people, they start interferon therapy in allopathy. Some go for homeopathic treatment. Various kinds of treatments are taken by the patient, but most of these patients do not give good recovery to the patient. Why? The major reason for that is that most of the physicians are treating the patient on the lines of liver tonics. They are providing the patient with medications which are for promoting the functionality of liver. But to be very true, if we want to make a person hepatitis negative, the first thing that the patient should keep in mind is, do not worry if you are hepatitis positive. The reason for that is, being hepatitis positive and having hepatitis are two entirely different things. If your body is having hepatitis virus, you are hepatitis positive. That virus may on some day damage your liver, but it may not damage. In many of the cases, it is harmless. It does not provide any kind of damage to the liver. Still, the person keeps on worrying. I'm nowhere saying that let the virus remain in your body. We are here with the help of a triple mode of action. We can definitely bring all the tests to the desirable extent, and in many of the cases, we can provide complete recovery in such a case. You can keep a track of the regular recovery with the decreasing ELISA levels, with the decreasing viral load. With each and every test, till date, that is available in allopathy, be it surface antigen level, be it core antigen level, you can regularly go for those tests and keep on comparing that yes, you are improving with the help of the medication that is being provided to you. Now, how exactly our medication is acting? It's a triple mode of action that we use in the hepatitis patient. The first kind of herbs being used are antiviral herbs. These herbs directly attack the virus, as a result of which it brings down the titer levels of each and every test. This is the first attack on the virus. The second attack is with the help of our immunomodulator herbs. We provide the patient with those herbs which modulate the immune system, potentiate it so that it can also directly attack the hepatitis virus. That is the second attack on the virus. And the third and the most important attack is habitat destruction drugs. We provide the patient those medications which destroy the natural habitat. See, any kind of microorganism or living organism, it requires a particular set of conditions for its growth or its survival. If we change those conditions, make those conditions unsuitable for the growth of that organism, slowly and gradually, that organism is no more. This method is known as Prakriti Vighat in Ayurveda. So this is the final attack that our medications do on the hepatitis virus.
Call now to connect with world's senior most Ayurvedic healer, Dr. Navdeep Sharma.